Veterans and their families had a chance to speak out tonight about problems at the VA in Tomah.
The VA held a town hall meeting with leadership at the medical center, focused tonight on those allegations of overprescribing painkillers and a hostile work environment. News 8's Kyle Dimke was at that meeting. He joins us now in our studio with more.
Well, Mike and Martha, tonight's meeting was only about half full, but was a much larger crowd than the usual quarterly meeting between patients and staff. About 20 people took their turn to either talk about their concerns with care and practices at the Tomah VA or to thank the VA for everything it's doing. Of the 100 or so people at the public forum at the Tomah VA, most of the veterans spoke positively of the care they received at the VA. However, one woman who doesn't feel the same is Carol Peterson Waters.
I'm not proud of the VA anymore.
Carol claims her father died because of neglect by staff while he was a full-time patient at the VA from 2003 to 2009.
I was so hurt because I had so much respect for the VA.
Carol says VA staff canceled physical therapy appointments for her father and took meals away from him before he was finished eating, causing him to grow incredibly weak.
That's where he said they're putting me down, and I didn't want to hear that from my dad.
A veteran who has also seen change in patient care is Ryan Vandywalker. He was a patient of the man at the center of the allegations of overprescribing opiates and a hostile work environment, Dr. David Houlihan.
They've really been beneficial to a lot of veterans, and I think that the negative press has really not just hampered the VA's ability to serve veterans, but has definitely hampered their ability to continue forward with working here.
Ryan says when he started at the VA, he was bounced around from doctor to doctor. It wasn't until Dr. Houlihan and his team finally stepped in and took care of him that he felt comfortable coming to the VA. Now the team he has built a relationship with over the past 2.5 years is gone, and he wants them back.
I have new doctors, new patient care, and I have to learn how to interact with them. It really has affected me. I don't even want to come to the VA because I don't know the people I'm seeing anymore.
Now that everyone has had a chance to speak their mind, both Carol and Ryan say it's up to VA leadership to start making changes.
We took note of the criticism, we took names and phone numbers for patients who we need to follow up with.
And some of the other concerns brought up was the lack of female doctors at the facility for female veterans, the need for more time with doctors during group therapy for conditions such as PTSD, and the need for a swimming pool at the facility. Many veterans stood up asking for a swimming pool because they say their pain is much more manageable with aquatic therapy.
All right, thanks a lot, Kyle. And there are currently 3 investigations ongoing into the allegations at the Tomah VA. There is no timeline for those to be completed, but the VA medical director says when they are finished, all results will be shared with the public.